Good evening and welcome to Midlands Today. Today we have special report from Queen Elizabeth Hospital about an outbreak of food poisoning in Birmingham. Over 15 cases of food poisoning have been reported in Birmingham in just the last 48 hours. I have here with me Joe Richards, who is a student at Aston University. Joe took his friend to the casualty department just yesterday morning. Let us hear what he has to say.
Hi Maria. Me and my friend Tom went to a uni pub crawl on Tuesday. Tom only drank 3 beers, he is such a lightweight, and afterwards he ate chop suey from a real dodgy Chinese takeaway. When I came to get him for lectures on Wednesday morning, he will come out of his room.
What did you do then?
I drove him to the emergency room because he was vomiting, sweating, his hands were cold and he looked somewhat confused. He said he had a headache.
Let us go speak to the doctors at Queen Elizabeth who treated Tom yesterday.
Hi Maria, my name is Dr. Ellen Cox. When Tom was admitted, he was noted to be physically fit and had consumed only a modest amount of alcohol. From the information provided by Joe, it seemed likely that Tom was suffering from classic signs of food poisoning. His blood pressure was marginally low at 108.
So what was your first plan of action?
Tom was put on intravenous drip to treat his dehydration. Seeing as he ate a Chinese takeaway and that to a prawn chop suey, the food poisoning may have stemmed from either the rice element or the fish element of the dish. As we are all aware of, incorrectly handled rice can cause the onset of violent vomiting and stomach cramps, all courtesy of a bacterium called Bacillus cereus.
How could the prawns have caused it?
Tom may have eaten prawns that were probably off or not refrigerated properly, all of which may have led him to scombroid poisoning. This is simply when the fish undergoes a toxin reaction, converting histidine into histamine, causing complications in the individual. This conversion would see reactions such as those in an allergy in the patient. However, scombroid poisoning tends to produce rashes and increased blood pressure. Both of these symptoms were not present in this case. Professor Hilton, who is a leading microbiologist at Aston University, is able to explain more.
Essentially, B. cereus is a bacteria responsible for several foodborne illnesses. The B. cereus is a facultative anaerobe which can produce indisperse. The bacteria is typically contracted from fried rice dishes which have been left at room temperature for hours. At room temperature, the spores grow into bacteria which produce toxins.
So, what happens when these toxins are ingested?
When the toxins are ingested, they can cause 2 types of illnesses, diarrheal and emetic form. The latter is usually caused by rice, and that's what it looks like Tom is suffering from.
Here with us now is Jane Smith, who is the biomedical scientist working on Tom's diagnosis.
Hi Maria. In order to confirm Tom's diagnosis of scombroid food poisoning, we will carry out some antibody tests. On infection, Tom's body would have produced antibodies against the B. cereus antigen in his bloodstream.
How will this test work?
Basically, the test is an enzyme-linked immunoabsorbent assay. It will detect the antibodies present in Tom's blood, and these results will be displayed in the form of a light emission. This will then be compared to a control sample, and if it matches the control, then that confirms the presence of antibodies against B. cereus.
Thank you, Jane. We will now go back to Tom's doctor for an update on the situation as of this morning. Hello again, Ellen. How is Tom doing now?
Hi Maria. Over the last 24 hours, Tom has been treated for the symptoms of hypovolemia.
What is hypovolemia?
Hypovolemia results from a decrease in volume of blood in your body due to blood loss or loss of bodily fluids.
Thank you, doctor. Please continue.
As I was saying, Tom has been substantially rehydrated, but he is still showing symptoms such as abdominal discomfort, rapid breathing, and no oliguria. We think that this is because he is in hypovolemic shock. Hypovolemic shock is a condition where fluid loss makes the heart unable to pump enough blood around the body. This kind of shock can cause many organs to stop working. It could be possible that Tom has suffered some damage to his kidneys due to hypovolemic shock. This possibility of organ damage has resulted in the presence of oliguria and Tom's complaints of continued abdominal discomfort. There is a possibility that Tom has an acute kidney injury, which has led to him being unable to maintain fluid, electrolytes, and acid-base balance.
That is it for our special update on the food poisoning outbreak. Next up is Jill with the weather update. Thank you and good evening.